Ever wondered why hot flashes hit so hard during menopause and perimenopause? Well, it's all because of estrogen's effects on the brain. Welcome to the Wild Wisdom Show. I'm your host, Dr. Patricia Mills, a medical doctor with the root cause approach to health. And today we're going to be decoding menopause. We're going to be talking about the hormonal shifts and symptoms all the way through from perimenopause to postmenopause so you can clear the confusion, truly understand what's going on so you can take right action to improve your menopause transition experience. In order to do so, we're going to be talking about the physiology of that menopause transition, the hormone shifts that happen throughout, stages that occur as a result, and some of the symptoms that you may experience and why they are experienced. So let's dive right in. The physiology in terms of why menopause happens and the hormone effects on brain versus tissue is so important to understand. And to be honest, in medical school, we're not taught a big, deep, not taught about this in a lot of depth. If you go into gynecology, I think it's about 6 hours of teaching on menopause altogether. So it's definitely an area that I needed to really hone in on and really look at the research and dive deeper into. And what I found is absolutely fascinating. So when we go into menopause, it's because the eggs in our ovaries start to run low in numbers. So over time, we are losing our eggs, and the eggs being created and released every month in our cycle are responsible for some of the hormones that are produced in the ovaries, such as estrogen, progesterone, and testosterone. So when we start to lose ovarian function because our egg supply is starting to run low, we start to lose estrogen, progesterone, and testosterone, but less so testosterone because testosterone and progesterone are also made in some amounts in the adrenal glands. The adrenal glands sit on top of your kidneys. And testosterone can also be made in the periphery and other tissues, such as the fat cells. And interestingly, some types of estrogen can also be made in fat cells as well. So the estrogen is the one that hits the hardest because that's the primary source of estrogen is in the ovaries. Now, what's interesting to know is that the estrogen, once it's made by the ovaries significantly and by other tissues in smaller amounts, gets floating into the bloodstream, and then it goes to various tissues, including the brain. And there's actually what are called receptors to estrogen in the brain. Receptors are like receiving, like the receiving of the estrogen. So if you think of estrogen like a key, the receptors are like the lock, and the key has to fit into the lock. And once that key goes into the lock, the door opens, so to speak, to various functions that can occur inside the brain. And so estrogen affects the brain in many different ways. It actually regulates or impacts, I should say, blood flow in the brain. It also goes to areas of the brain that are responsible for what we call cognition, particularly the higher level areas of the brain in the front called prefrontal cortex are very highly evolved areas of the brain that are responsible for things like memory, planning, and judgment. It's also involved it also impacts hormones that are made that impact our mood. So whether or not you're feeling great or you're feeling low or anxious or depressed can be affected by estrogen. It also goes to the part of the brain that is responsible for temperature control, and that will be important to understand when we start talking about hot flashes and night sweats. It also affects the area of the brain that is involved in libido or the desire for intimacy. And interestingly, it also provides protection for the brain. It helps protect the cells from damage and helps the cells regenerate and get healthy again. So this is really interesting because this is not something that we've known for a very long time, and it really starts to give us insight as to why do we start experiencing some issues with symptoms like hot flashes, mood, insomnia, depression, irritability as we're going into that menopause transition. Now, the tissue effects of estrogen are better known. So it affects the vaginal tissue and the uterine tissue, which is why you'll start seeing changes in your menstruation. And usually when we talk about stages of menopause, people are really like honing in on the menstrual changes, right? But did you know that even the vaginal tissue, when it loses estrogen, it starts to thin out and dry out? That's why women experience issues with like pain with intimacy, dry, like vaginal dryness. That can also contribute to the decrease in libido. So, more like the body versus the mind connection to that. And you'll get an increase in urinary tract infections because the microbiome of the vagina starts to change for the worse. And the distance between where the pee comes out and that vagina actually decreases because of that, the thinning and loss of tissue. So you start to get an increased risk of urinary tract infections as well as we go through that menopause transition. The bones also have receptors for estrogen, and that the signal is for bone growth when it comes to estrogen. As we mentioned, the uterine tissue is affected. Our skin and our hair. Did you know that our hair follicles have receptors for hormones like estrogen? So it does regulate hair growth. It goes to the heart and the blood vessels and affects the health there. And it also goes to the liver and it modulates and sort of, impacts things like cholesterol production. Again, one of the reasons why as we go through menopause, we might see an increase in things like cholesterol. So now that we have a better understanding of what estrogen does and what the effects are on the brain and other tissues, let's go into the stages and some of the symptoms or experiences you might have as you're going through these stages. And it might surprise you that in some ways, perimenopause is actually a harder thing to transition through than menopause itself, than to experience. And you're going to see why that happens. So the stages and symptoms of menopause transition. And what you have to understand is that the menopause transition can actually happen over many, many years. Now, women, they say that the average time that women hit menopause is around 52 years, but it can be anywhere from 40 to 60. So you could have a woman going into menopause at the age of 40 and a woman going to menopause at the age of 60. Now, there are extremes beyond that, which we'll talk about, but it's just so interesting to see that every woman's experience is so unique and it depends on so many factors, including genetics, environment, and lifestyle. Now, if you go through a natural menopause, and what I mean by natural is it wasn't caused by an injury done to the ovaries as a result of surgery, like oophorectomy, or medications like chemotherapy, those are known to damage the ovaries. Even a removal of the uterus can indirectly damage the uterus because it affects the ovaries, because it affects the blood flow. So when you remove the uterus and leave the ovaries, you can actually still get ovarian damage because that blood supply is negatively affected. But assuming you haven't had any of that and you enter into menopause, then you would be considered to have natural menopause as long as it's between the ages of 40 and 60. If it's between the age of 40 and 45, you'd have what's considered early menopause. And if you enter menopause spontaneously before the age of 40, then you have what's considered primary ovarian insufficiency. So for whatever reason, genetic, environmental, and lifestyle, your menopause transition happened much sooner. So for example, the genetic would be someone with Fragile X as an example. Environmental could be high exposure to toxins. Lifestyle could be things that really dysregulate your hormone health and your hormone production, so that there's an indirect impact on the ovaries. The ovaries can become inflamed due to issues with poor gut health. We'll go into this more in a future episode. But what I want you to understand is that there are phases and everybody's transition is different and unique, and it can happen if it's medically induced or surgically induced. It can happen within months. Typically, it happens over a period of years, sometimes even 10 years, sometimes longer. And again, there are things that will modulate that time beyond your genetics. So some of it is preset by your genetics, determined by your genetics, but it can happen sooner and more severely if things happen on top of your genetics to affect your menopause transition. So here we're talking about how we determine what stage of menopause, your perimenopause, you're in. And this is more for people who are going through that natural, spontaneous perimenopause and primary ovarian insufficiency. If you have that surgical removal or the medication effect, everything may happen so quickly together that you almost can't differentiate between the stages. So the 4 stages are early perimenopause, late perimenopause, early menopause, and late menopause. Okay, so we're going to dive into each one. Now, Typically, doctors will say that you're in early perimenopause if you start to experience changes in your cycle, your menstrual cycle length. So it can get longer or shorter or heavier or lighter, more painful, right? Things start to shift. Now, you have to look at the age, obviously, because, for example, there's conditions in very young women and even teenagers where they're athletes and they're exercising really heavily and their period goes away even. So they start to experience variable cycle length and even lose their period. That's not menopause because you have to look at the overall context. What stage of life is this person in and what are the contributing factors? So sometimes I see people who are going into what could be considered early perimenopause, but actually they're having issues with their hormone balance from excess stress, the toxins effect and all those sorts of things. And if they don't reverse out of it, then they can continue to lose that hormone balance and over time get into menopause earlier. But generally speaking, if everything else is going, according to nature's way, early perimenopause, you start to experience variable cycle length. But actually, it can even start to happen before that. And what's interesting is that in perimenopause, especially early perimenopause, it's when the ovaries are first starting to kind of like hit some, stops and starts. So they'll release estrogen and then not release estrogen and then release estrogen and not. And it'll actually be, if I were to chart it out before you hit perimenopause, your estrogen release is like pretty cyclical over the months. So it goes up a lot and then down and up a little and then down for over a cycle. And then that repeats itself. So overall, if I were to zoom out, overall, your estrogen levels are kind of stable. They do vary inside that monthly cycle, but that variation is pretty predictable from month to month. In perimenopause, estrogen levels start to go crazy. It's like if you think of a roller coaster versus a highway, it can go up even higher than you used to make it and then crash down very, very low. Up higher and then down low and then a little bit higher, a little bit less low, and then high and low again. It can go all over the place. And that variability, that change in estrogen levels that is so significant and unpredictable from day to day, week to week, month to month, that's what starts causing the symptoms. And actually where it can be felt first, even before you get that abnormality in the cycles, is in the brain. Because remember, I said that estrogen has many effects in the brain. So you might even start off experiencing perimenopause with those brain symptoms. So you might start to get the hot flashes and the night sweats, a new or worsening premenstrual syndrome, more depression and anxiety. And a big tell for that is it will tend to be worse, just before your menstruation. But it can also be all over the place, right? Because again, it's just the ovaries are no longer doing the job that they've done all along. They're kind of starting to head into retirement. So they're going in like crazy directions all over the place. Okay. So it can be surprising for women that perimenopause can actually be much harder to go through than later, the late stage menopause, which I'll explain to you what happens to estrogen by then. And by that late stage menopause, right, from early perimenopause to late perimenopause, early menopause to late menopause, the brain actually undergoes remodeling. So it recognizes that it no longer is having a steady supply of estrogen, and it'll start to remodel and change. And some functions will be lost. And it seems to be that the functions that are lost are the ones that we no longer need. Like for child raising, you need to be very vigilant and very attentive, right? You have to be so like multitasking and all the craziness. Whereas when we're older and we're no longer directly responsible for child raising, what we tend to gain in terms of brain function, and it starts to come out as stronger in menopause, is the ability to be empathetic, to tune into other people's emotions and respond to them adequately, to be calmer, to be less reactive, less vigilant. So some of that brain remodeling is actually quite positive in the long term. But in the short term, while the brain is going, oh my goodness, what's going on with this estrogen? It can be experienced in many different ways. And it can sometimes be quite severe in terms of that insomnia, difficulty sleeping, the mood changes, the brain fog, like, forgetting people's names, forgetting where your keys are or where your phone is, So all of those things can be a very normal part of that perimenopause transition into menopause. And it can be surprising for a woman when it hits them and they're not expecting it. And it can be very overwhelming and distressing. And sure, you can turn down the dial on those symptoms, like decrease the severity of them, with holistic approach, right? Nutrition, exercise, movement, stress reduction, all those things. However, it is probable that there's some of that to some extent will be experienced along the road for women. And again, that is a very variable, seems to be very unique for every woman in terms of what they experience. So what you're going to see in that perimenopause transition, in that early perimenopause is, as I mentioned before, the worsen or new PMS, hot flashes and night sweats, irritability, depression, anxiety, insomnia, those cognitive changes like a hard time with concentration, even things like planning, judgment, and higher level thinking, and even for some women, worsening migraines. Because remember that estrogen affects blood flow. So sometimes when the estrogen is like too high and then too low, that can actually cause the migraines to get worse. Although typically once you hit menopause, women tend to experience a decrease in their migraines, although a small few actually continue to have them and some even less get worse. The tissue symptoms is that because the estrogen is going all over the place, very high, very low, you can actually get things like fibroids that are growing, more breast pain. We mentioned the variable cycle length, a low libido. You can actually have heart palpitations. So the heart racing or irregularly beating in the chest. And that can be very scary for women. And they might go to a heart specialist, and the heart specialist like checks out your heart and everything is fine, right? But what's really happening is that you're transitioning into menopause and you're having hormonal shifts. And so recognizing that might actually lead you down the road of seeing someone, for example, holistic hormonal health management, or maybe some hormone replacement therapy or non-hormonal therapies. So you wouldn't be seeing a cardiologist for it, even though the problem is starting in the heart, which is so counterintuitive, but so important to understand. Also, you might get a bit more joint pain, dry eyes, and weight gain, because weight is very, very influenced by hormones. So again, a holistic approach to supporting your hormones in that menopause transition will actually help you with that weight gain. And it tends to be a weight gain around the belly. And we want to minimize that kind of weight gain because it's a very inflammatory belly fat that we don't want to have on board. So you'll want to be paying attention as we go along, and with the with all of the information that is provided in these episodes, to learning how to manage your hormone fluctuations during this time to minimize any collateral damage done during that menopause transition. And it is possible. You are not destined to gain weight. You are not destined to have permanent issues with your mood or with your sleep or anything like that. All of those things can be altered. Research does show that. Some of it is genetically determined for sure, but it is very much a nature and nurture scenario, which I think is good news. Now, you've hit late perimenopause if you've had 2 or more skipped cycles. So you've skipped your menstruation, and you may even have a multiple months of no menstruation. But as long as it's under 12 months of no menstruation and over two cycles, so over 2 months and under 12 months, then you're in that late perimenopause phase. And it's a similar symptoms as early perimenopause, except you're getting a bit more of that tissue effect as estrogen declines and the brain is attempting to adjust. So you might notice that things are kind of lightening up on the brain front, but still like getting a little bit worse in terms of the tissues, especially if you're not supporting your body through that transition. Menopause itself is determined by being 12 months with no menstruation. So you might actually be in late perimenopause with 11 months of no menstruation, but you won't be determined to be in menopause until you hit that 12-month mark. So what's interesting to know is that this is not determined by blood work. No one can do blood work and say, "Oh, look at this blood work. I'm in menopause now." That's not how menopause is determined. There are trends that we would see on blood work, like low estrogen and high follicle stimulating hormone, or FSH. But there's no like cutoff at which, wow, you're in menopause now. Because again, it depends on so many different circumstances. Every now and then your ovaries can release a little bit of estrogen still. The brain function changes over time. And so it's not reliable to use blood work. The most reliable is 12 months with no menstrual cycle. After that, you've now entered into early menopause, and you'll be in the early menopause phase for around 4 to 5 years. That's generally what's considered early menopause. And interestingly, the symptoms are the similar as early perimenopause, but improving. It actually can be better in terms of the brain symptoms. So you might start to experience a lessening in your hot flashes, a lightening in the mood, some improvement in insomnia. That's again, depending on how you've been holistically, managing your life and your lifestyle with that menopause transition to support the brain through that period. The tissue issues such as vaginal dryness, urinary tract infections, and sexual dysfunction can be more pronounced because, again, you're still dropping low on that estrogen. Generally speaking, the trend is to go low, okay? And once you lose the tissue, right, it's hard to like just gain it back with a little bit of highs, whereas the brain is immediately impacted by the highs and the lows. So the general trend is vaginal dryness, vaginal thinning, which then leads to those urinary tract infections and that sexual dysfunction and other things like your skin. You might notice your skin continues to lose its vibrancy and elasticity, the hair as well. Maybe some issues with the joints are going on. And into late menopause, which is more than 4 years after that menopause, research shows actually that generally speaking, brain symptoms are much improved as the brain has now adjusted. So for most women, you tend to get lightening of those hot flashes. Maybe they go away completely. Actually, research has shown that around this time point, the quality of life. So if you were to give someone a questionnaire about, how would you rate your quality of life? It can even be higher in this phase than it was before perimenopause. So there seems to be this beautiful, adjustment to that the brain has done in response to the changing levels of estrogen. And we do see the light at the end of the tunnel. What's interesting is that we're one of the few species that actually goes through menopause and survives it. There's only a handful of species as far as I'm aware, and I'm sure I'm not getting them all, but there's a Japanese aphid. There's a few types of elephants. There's one type of, I think, ape, if I'm not mistaken. But anyways, it's not even chimpanzees even don't survive into menopause because generally speaking, nature seems to choose to maintain fertile humans and let go of fertile mammals and species and let go of those that are no longer fertile and procreating. But for evolutionary reasons that we're beginning to understand, nature has decided to select in humans for ongoing life beyond menopause. And so it's developed this strategy to allow us to continue and to have a good quality of life. However, I think what we need to do is we need to use that holistic approach and what we've learned about how to best support our tissue health so that the effects on the tissues like the osteoporosis and, if you're not careful with your menopause transition, you are at an increased risk for heart disease, heart attacks, stroke. You're at increased risk for high cholesterol, obesity, dementia, and Alzheimer's, diabetes. And you'll continue to have issues with vaginal dryness, urinary tract infection, sexual dysfunction. So it's really nice to know that a combination of nature helping us continue to survive this point onwards, plus what we've learned over decades of observation and scientific research, we can now even better support women beyond that phase. Men continue to be fertile for much longer, so they haven't had to have this period of adjustment and the need for us to really understand these things, although men are suffering from their own issues in this modern world these days with low testosterone and those sorts of things. But nature itself did not program that. That seems to be something related to modern living. So the good news is that research is showing that attention to nutrition, stress, movement, and toxins can improve the menopause transition. And we want to transition into menopause because that means that, first of all, we're alive. The only way you can't get into menopause is if you die before menopause happens. And what's beautiful is that one of the potential reasons that menopause happens and that we are surviving past it is what's called the grandmother effect, although I would like to call it the wise woman effect, where it's been, if you observe the way that our culture has worked over, hundreds of years, looking at the current hunter gatherers as like an example, the older woman, when they're no longer procreating, they are no longer fertility competing with the younger women. And they're actually helping the younger women out with child raising, with gathering food, cooking food, preparing food, minding the family. So, that's no longer really so much what our role is as older women in society. Although, wouldn't it be beautiful if we are able to continue to support that in as many ways as possible for the sake of our the health of the family unit and of our society in general. However, what that means is that we have values, we have attributes, we have wisdom, we have experience. We have so much that we can contribute to society based on the years of learning, and as a result of those brain changes that have made us less reactive, more empathetic, more in tune. Age is just a number when it comes to our ability to provide and produce and contribute and create. So being able to see the joys and the beauty of menopause is such an important part of that menopause transition that we need to really be able to focus on that and be aware of it. And for some of us, and actually seems like it's quite a few of us these days, we may benefit from some additional therapies like bioidentical hormone replacement therapy and some non-hormonal therapies. And that's to ease that. There's a couple of reasons why. One is to ease that transition through so that the roller coaster isn't so crazy, not so many big highs and low lows. It just evens it out. And another reason too is that to potentially offset some of those long-term higher risks that we have, such as the osteoporosis and the dementia and Alzheimer's. And there's a lot of really interesting research coming out. It may seem conflicting, like you might be hearing about lots of different things in the social media and the news. A lot of the conflicting information comes from the different kinds of hormone therapies that are being used, such as non-bioidentical compared to bioidentical, the misunderstanding around what bioidentical really is, right? Which we're going to be getting into in the future. So as long as you're very clear on what you're looking at and the information that you're getting from these studies and some of the limitations of these studies, it actually is pretty straightforward in terms of, what are some of the benefits of those, so long as you're paying attention to the foundational things. Like you cannot out supplement and out medicate a lifestyle that does not support a healthy menopause transition. So we need to be able to go through that with ease and with joy and with wisdom. So it is a myth that menopause is a disease. It is not a disease. It is not a diagnosis. It is a life stage that can become full of suffering and additional medical conditions if we don't treat it with respect, if we don't prepare ourselves for it, if we don't arm ourselves with knowledge and wisdom, knowledge and action, so that we can navigate this journey with ease and, a feeling of control and understanding versus feeling like you're just being tossed in the winds, being tossed in the waves of your estrogen roller, crazy ride. So I hope that you found this helpful. If you enjoyed this, please share, save, subscribe to this channel. If you're watching this on YouTube, if you're on podcast, subscribe as well, leave a review. This is what helps other people find this wisdom, and sharing is caring. So just don't keep it to yourself, right? You never know when there's someone in your life who might just significantly benefit from this wisdom. Thank you. And I hope that you have a wonderful rest of your day, evening, or night, depending on when you catch this. Until next time.